Print, email, Facebook, Twitter. More email detailing abortion terms and attempt to limit access in Tasmania. Labour claims Tasmania's opposition has accused the state government of sending out a directive to doctors at the Royal Hobart Hospital, RHH, trying to further limit access to surgical abortions. Access to abortions has been dramatically reduced since Tasmania's only surgical abortion clinic closed in December, prompting the Tasmanian government to offer travel assistance to women to go interstate for a termination. Medical professionals who have contacted the ABC, but did not wish to speak on the record, have raised concern about an email from the Tasmanian Health Service GP Liaison Officer South on April 17. The email said there had been an error in a previous newsletter and that the RHH Gynecology Clinic offers priority access to surgical termination of pregnancy to women who are less than 14 weeks gestation and assessed as vulnerable. It states the clinic can only be accessed by GP referral, clearly stating why the woman is vulnerable. Vulnerability may include, but is not limited to, socioeconomic hardship, sexual or domestic violence, physical or intellectual disability, or acute stress or mental illness, the email said. The doctors questioned the timing and wording of the email and the characterization of the word vulnerable. 5 days earlier, on April 12, the Royal Australian College of General Practitioners said RHH doctors were accepting referrals for terminations after 9 weeks of gestation. The comments prompted Health Minister Michael Ferguson to state there had been no shift in government or hospital policy, and no change to services provided at the hospital. Opposition health spokeswoman Sarah Lovell said the timing of the email was suspicious and suggested the health minister was behind it. This is about making it more difficult for general practitioners to work with Tasmanian women to find solutions for them when they are making a decision accessing a termination of pregnancy in the public health system, she said. This is clearly an ideological position. There is absolutely reason why this procedure can't be performed in Tasmania. Hobart Women's Health Service CEO Glenise Flowers said she understood a decision had been made to prioritise vulnerable women. It is our understanding that limited access is due to capacity in the hospitals, she said. It's unfortunate. Our view would be that public health services should be available to all women. Hobart Women's Legal Service CEO Susan Fye said the only impediment to introducing terminations in public hospitals was government policy. It's really down to policy. There is no other explanation other than government policy, she said. Ms. Lovell said Mr. Ferguson was standing in the way of public access to terminations. And it is the Premier who is standing aside and letting this happen, she said. If the minister can't put his own personal beliefs aside to make a decision in the best interests of women, then he should resign from his position. A spokeswoman for the health minister said in a statement he does not interfere with clinical decisions. The Tasmanian Health Service was contacted for comment. Print, email, Facebook, Twitter.